Good evening, everybody, and welcome to this session, the Royal College of Nursing question and answer on pay. I'm really pleased to be here with you this evening and hosting this event. My name is Helen Wiley. I'm the Executive Director for RCN Wales, and I also have the Executive Lead for Members Pay, as well as the Member Contact Centre RCN Direct and our Member Support Services. So it's an absolute pleasure to be here with you this evening to host this question and answer session. And without further ado, I'd like to introduce you to your panel this evening. I'm really pleased to firstly welcome Rachel Hollis onto the panel. Rachel is the chair of the RCN Professional Nursing Committee. The RCN Professional Nursing Committee fulfills a vital role in helping the RCN to achieve its purpose as a Royal College. The committee is the decision-making body of the RCN on professional issues and provides leadership on the work of the RCN in this area. It is, of course, accountable to RCN Council. Rachel is the member for Yorkshire and Humber and is the chair of the committee. Rachel is an honorary nurse advisor for children's cancer nursing in Leeds Children's Hospital at Leeds Hospital NHS Trust. So we're really pleased to welcome Rachel this evening onto the committee. And Rachel is joined by her colleague Graham Reevy, who's the chair of the RCN Trade Union Committee. And the RCN Trade Union Committee works to ensure that the RCN develops as a modern progressive trade union, making a positive difference to the working lives of nursing staff. The committee is accountable to RCN Council and makes decisions on its behalf of all RCN trade union functions and activities. Graham is the Employee Director of NHS 24, where he focuses on developing effective partnership working between NHS 24 and NHS trade unions. Graham's substantive role is that of a senior charge nurse. And I know that Graham has been with us on one or two of these Qs and As over the last few weeks. Our question lines are now open, so if you are joining us, please see at the side of the team meeting a space where you can put your questions in for the panel to answer. Please feel free to populate them with as many as you would like, and we will do our very best to answer as many as we can. We've allocated 1 hour for this session, and I intend to make sure that both Graham and Rachel are kept on their toes, answering as many things as we are able to take in this 24 hours, in this 1 hour, beg your pardon. I was going to keep the panel on for a long time. My apologies for that. So I want to get started straight away. I can see that questions are popping into the box already. And the first question is going to be for you, Graham. So the first questioner is asking, why has the RCN decided not to support the grassroots movement of a 15% pay rise? Straight in there for you on that one, Graham.
Thanks very much, Helen, and I'd like to thank colleagues for joining us all tonight. I'm really pleased to be here again and to discuss what is becoming my lifetime's favourite subject. Feels a bit like mastermind. I want to actually just, the grassroots movement for a 15% pay rise. I think probably what I want to explain here is why we got to 12.5 for the pay claim for the Royal College of Nursing. Well, we got to 12.5% through a lot of consideration. We've been working on this for about the last 5 months, and during that period of time, we've looked at various pieces of data and various reports and various types of modelling. But most importantly, February into March, we ran an all-member survey. So we sent a survey out to the 450,000 members that we've got within the college. And we had what I would really totally surprised me, because we had 42,000 members return that survey. That is unheard of in the RCN's history of taking surveys. That is a significant, almost 3 times what we would normally get. So a good representative survey. During that survey, we asked members what their views were on pay. We asked members what their views were on how they felt valued. We asked members what it was like to work through COVID. So all of these things came into the survey, and that started to form where we thought would be a reasonable ask to put forward for pay as we started to take that forward. So we got to the figure and we wanted to test that figure of 12.5%. We then took that figure of 12.5% out to, first and foremost, to Council, who ratified that decision. We then went to all of the governance committees throughout the RCN, both the elected and the appointed. So we went both to the trade union side and to the professional side of the organisation, because we have got the realisation there is around the implication of pay, staffing and safe staffing levels. So that's really important, and I think we'll get a lot of conversation around that tonight. So we went there, and we also went to all of the regional and country boards, and we said, where we invited the branch chairs along to the board sessions, and what we were doing there was testing. Does this feel right? Because it's a broad-based membership. We couldn't go out to our members at that point in time and say, does this feel right to you? Because we were trying to formulate ideas. So we then went out, and that's where we came up to the 12.5%, Helen. The 12.5% was a figure that is a substantive pay rise this year. It's consolidated, and it basically is sitting, and we are asking for it for all bands of staff, all grades of staff under Agenda for Change. So that's why we got to the 12.5%. Why are we not at the 15%? Because the evidence that we looked at, and it was an evidence-based approach that we took us to the 12.5% figure.
Thank you, Graham. And you made reference there to sharing thinking and testing ideas with professional side of the college. So Rachel, I'd like to just come to you and get your reaction really about what you or your committee felt about where the final claim has landed for the NHS pay claim for 2021, that 12.5%. Wonder if you want to make any comment on that.
Thank you, Helen. Yeah, and I think the first thing that I'd like to do is sort of recognise and thank Graham and the Trade Union Committee for the extensive work that they did to actually get the views of members. I think, as Graham has alluded to, we had the member survey, so that gave a really good wide view. But Graham came to our Professional Nursing Committee on a couple of occasions to talk through, as the claim was being developed, really, where the thinking was at, and where they were coming to, and most recently around the 12.5%. And I think our committee felt that it was right that we should be looking for a substantial pay rise, that really reflects the work of nurses, the skills, the knowledge, the responsibilities that we bear. But I think also one of the things that for our committee in particular, one of our real focuses is around safe staffing, and I think that's something that we're going to come on to, I'm sure we'll come on to discuss more later, but feeling that actually fair pay is also about how we address the crisis that we have currently in staffing. But I can see that there's perhaps another question coming on that, so I'll leave that there to pick up, Helen.
Thank you, Rachel. And yes, I would like to go there next. So a couple of our questioners are asking aspects around safe staffing. So one question that's coming through, Rachel, is safe staffing incorporated into the RCN pay position in terms of this campaign?
So I think this campaign very much reinforces some of the work that is still being done in our previous campaign, or our current campaign, on staffing for safe and effective care. And I think the member survey that Graham referred to, one of the things that people talked about very much was how pay was important in feeling valued, but also saying that, you know, we had a significant proportion of members telling us that they were thinking about leaving the profession. And one of the most important factors in that was pay. Now, it wasn't the only one, and it was followed quite closely by safe staffing. So I think certainly for us in the Professional Nursing Committee and many of our members, the two go hand in hand. And I think if we reflect on the very successful campaign that ran in Northern Ireland last year, then you could see how pay and safe staffing really were parallel themes for the campaign. So the 12.5%, the fair pay for nursing, is not just about the nursing, but it's also about how we use fair pay to address some of the staffing crisis that we have.
Thank you, Rachel. That's a really full answer, and I think really helpful to hear from you as the chair of the Professional Nursing Committee, just to how important it is that safe and effective care work lines up with our work on pay. I'm going to give Rachel a break for a moment and come to you, Graham, because you made reference when you were speaking earlier about how we'd got at the 12.5% about the member survey, and somebody has asked in the questions, do you agree that, with respect, that the timing of the member survey could have been during a better period, because many of our members may have been busy treating and obviously caring for patients with COVID-19?
That's quite a difficult question to answer, because actually the member survey was not specifically around pay. The member survey was designed to actually test the effectiveness of the RCN's interventions on work experience during and what was a crisis in healthcare management. So basically, we were asking questions on what is your work like, how are your managers treating you, what does that feel like, as well as looking at the concentration of pay. What does work feel like during the COVID crisis and the pandemic? So the timing of it was actually, although we're asking questions around pay, we're also trying to assess any of the interventions that the RCN had carried out in relation to making sure that people had the correct PPE. As I said, it was member-wide, so it wasn't just in the NHS. We were looking at care homes, and care homes, we know, during that period of time were suffering quite significantly from the lack of PPE, and it was due to the RCN's interventions. A lot of that the care home staff actually began to get that stuff filtering through. So in terms of when to carry out a survey, when is a good time and when is a bad time, when we're actually looking at trying to determine and get some good quality data, but that quality data was really wide-ranging, Helen, and there was a lot of information in there, not just on pay. It was data on the health and safety and well-being of people while they were at their work, how they felt and how they felt there, whether they were supported by the public, whether they were supported by their managers, quite importantly, whether they were supported by the government. We saw the government clapping their hands every night outside Downing Street, etc. All of that was in that survey. So I think the survey for me ran at a time, I don't think there would have been a good time, and even if we ran it now, I think what would happen is we would have been too late to meet a lot of the targets that we needed to meet. So we had to test, and that's one of the reasons why the committee wanted to build on what the members had told us and test that with a wider membership. I mean, we went to about 180 people. I know that that's not the entire membership, but those people are all elected to represent people in membership. So we thought that was a good way of taking that forward. Does that answer the question, Helen?
Thank you, Graham. Yeah, that was a good and full answer. I think people online will have been enjoyed listening to that. But I think I'd like to bring Rachel in as well, because as you say, the survey didn't just sort of deal with pay type of issues, and it didn't just go to NHS members either. So Rachel, I'll just remind you that the question was about the timing of the survey, but any reflections that you have on the survey, I would be grateful to hear them.
And I think it was on that timing point, really, Helen. And I think first to just reinforce what Graham said about the response to the survey. So I think, partly the proof of the pudding is saying we had 42,000 people answer the survey, which is the highest ever. And arguably, you could say that actually the time during COVID was a great time to do the survey, because there was a real focus on nursing. I think, as Graham has said, the survey is about many things. It's not just about pay, it's about how nurses feel valued, it's about working conditions, it's about safety, it's about staffing. And I think the other thing that I would like to say is that, as well as that, there's quite a lot of quantitative data in there, but there's also actually some really rich qualitative data. And I think some of that data really shows that the feelings that nurses were discussing in that survey, the responses that they were giving, were really that COVID had highlighted and strengthened feelings that were there already. So it was really reinforcing and emphasising some of the views. And I think that there's some really important data in that survey that will impact on the work, not just of Graham and the Trade Union Committee, but certainly our Professional Nursing Committee, where we are looking carefully at what the survey tells us in both that quantitative and qualitative elements. Thank you.
Thank you, Rachel. There's a number of questions coming in, so I'm going to use a bit of host license to try and theme them a little so that we can cover them. So there's a couple, and I'm going to go to you first, Graham, because they do have quite a trade union type of focus on them. So firstly, questions are back to the 12.5% and where we landed on 12.5% and what other unions are thinking. So in terms of the 12.5%, people are asking how will the 12.5% decisions be shared with members in the longer term, and also does it mean that we are out of sync with some other unions who are asking for a flat rate payment of £2,000 per year? So I wonder if I could just get your comments on those two aspects. So that's how will the wider membership see the detail underneath the arriving at the decision of 12.5, and does that mean we're now out of sync with other unions who are asking for £2,000 flat payment for everybody on every band for the 2021 year?
So the 12.5%, our members will get to see that, and they will get to see all of the background information when we are able to release that. And that is the reason why I say when we're able to release that. There is a lot of data and a lot of statistics in there that remain very much the property of the RCN and its members and should not reach the public domain until such times as we are ready to surface that. And it's really, really important that this is about, and many people will have heard me, we are entering into a negotiation. 12.5% is an opening position for the Royal College of Nursing. That is our pay claim. Do I think that we're going to get Rishi Sunak or Matt Hancock to turn around and say to us, "Okay, Graham, I hear what you're asking for, and I'm just going to give you it"? No, we're going to have to play a very, very tight game of negotiation, and therefore all of our figures remain private until they actually start to become something to be discussed over a negotiating table or through the peer review body process. So when that process is finished, we will be happy to share all of the data and let members understand exactly what that is in play. We can't do it earlier than that, because that's like showing your hand to another poker player and allowing them to combat any of the details that you've got before you actually get to the point of discussing that. So that's probably finished with that part of the question. The other part of the question is around the variations of the trade unions' positions. Well, all trade unions have a right to actually establish what their own position is. So the 12.5% that we've established for nursing was a very, very strong position within the staff side. Many members may have heard of where there was a leaked document by one of our sister unions, the one that actually has outlined the £2,000 to say that 13 unions had agreed this and one union was not. Well, that one union, I'm going to put my hand up, that was us, because we had a claim that we believed was a claim that we could verify and we could support going through that. So the RCN stood in the staff side and stood up for nursing. The £2,000 claimed by the other unions, it's up to them to come up with where they sit. It's up to them to come up from where they sit. But what I would say is that RCN's position looks after nursing, because so often we've had in the past is the low paid workers have been looked after to the detriment of the bands 5, 6 and 7. And what we are saying at this point is, by all means, we would not ever support anything that would actually put low paid workers at detriment. In fact, the 12.5% actually is more beneficial to them. But this whole idea of the low-paid worker being looked after in a preferential way to people of band 5, 6, 7, 8 and the senior nursing level, the nursing bandings, it's not fair, and it's happened too often. And basically what that's doing is it's compressing the middle bands and pay, which are the professional bands, and that is having an impact on the relationship with the profession and professionals, and that's having a relationship with safe staffing. It's having a relationship with the recruitment and retention of nurses. It's having a relationship with nursing being an attractive profession to enter into. So that's where that differential lies. So yes, we are standing outside the other unions, but we're happy to do that because we're standing up for nursing.
Thank you, Graham. I'm going to stay with you for this one, and then if you are losing your voice, I'll give you a minute off to grab a drink, and I'll go over to Rachel, because there's a question coming in that I know Rachel's going to want to answer. And this is a really important one, because what you've talked about is where we are with our pay claim. That is what the RCN are calling for. So this questioner is asking, are the RCN confident that this pay claim will be granted by the government, given the number of jobs being lost and due to the recession that we think the country will face in the coming months? It's a really good question.
It's a really good question, and it's one that I think taxed the Trade Union Committee quite a lot. We're going through a significant economic downturn due to COVID, and everyone recognises that. But what I would say is that NHS pay is the responsibility of government, and NHS pay is something that requires the government to authorise. Within that mindset, what we are saying is our NHS, the NHS that we all work for and love so dearly, has went through a crisis. That crisis, Rachel referred to it earlier on, 30%, that's a third of nursing, just under a third of nursing staff are thinking of leaving. If you can imagine the impact that that will have on workforce, and the primary reason that they said that they are going to leave the profession is because of pay and because of not feeling valued. So what I'm saying within this economic argument is that it would be absolute folly not to invest in the health service at this time. It would be folly because it's not investing in the health service as in bricks and mortar and drugs. This is investing in the most important asset that the health service has, and that is its people. And in particular, I want to talk about the people that I'm talking about is nursing and the nursing workforce, the biggest single workforce in the NHS that delivers care to the people of this country and therefore secures the economy of the country. And if we don't do it, then we will have an economic recession that will be even deeper.
Thank you, Graham. I can hear you feel very, very strongly about the role of nursing and how the government needs to step up and make sure that it values it and goes a bit further than clapping as it was doing once a week. So this question follows on, but I'm going to go to Rachel first because I really want to get her slant on this question from the professional nursing perspective. And the questioner is asking, if the RCN doesn't attain the ask in this pay campaign, will they go on strike for pay and safe staffing like our colleagues in Northern Ireland? I don't know if you want to give us some thoughts about that one, Rachel.
Thank you, Helen. Yeah, and it's a really difficult question, but it's a really, really important one. So I think, the first thing to say is that, strike action should, for any professional, strike action would be our very last action. We would have to go down a long way down the road before we consider strike action. But I think Northern Ireland showed us very clearly that actually when the point comes and when we've got so far and the government are not listening, when we've got a deal that that our members are saying we should be working for, then strike action if we need to go down that line, then I think that we should do that in a very professional way. And I know that when and I think we saw that really clearly in Northern Ireland, and I think that if we do down the line get to that point, then there are real lessons to take from the action that was taken there, to take the public with us, to take our membership with us. But what happened in Northern Ireland, I think we as a professional nursing committee commended the team to Northern Ireland, because actually that was a supreme act of professional judgment. The professional judgment of the nurses in Northern Ireland was that they had got to a stage where, for the safety of their patients, they needed to take that strike action, and that's what the decision that was taken. And that decision was taken by members working together with the staff, and I think was, as we saw, very effective. And if that's something that we feel that we need to decide, then we would work together with that. But it would absolutely be our last resort as nurses. It's not somewhere that we would wish to go. And what a difficult decision it was in our colleagues in Northern Ireland, and salute the bravery that they showed in that campaign.
Thank you, Rachel. Graham, I wonder if you wanted to make any sort of comments about the sort of strike issue as well, from the deliberations that you've had with the Trade Union Committee.
Well, I think, Rachel's summed that up really, really well. I think what we need to be recognising here is that we are actually in the beginning of a pay claim, and we have just started off I need to get it in, hashtag fair pay for nursing. And we need to get that hashtag in and get everybody, because what I want to have in everyone's lips in the next 2 weeks is 12.5%. So, but what I would say here is that in relation to industrial action, Rachel's very clearly indicated it's a last resort. But what that means is we are looking at a pay claim and a pay campaign that is actually taking us into the position of shouting from the street tops in an attempt to try and avoid industrial action. That's the whole purpose of having a campaign. It's actually getting to the point of avoiding industrial action, because it is a last resort. But should the government come back and give an offer and make a pay offer to the NHS health unions, then that pay offer is not going to be decided on by the Trade Union Committee or the Professional Nursing Committee or by Council. That offer is going to be decided by members. So if that offer is not one that the members are satisfied with, and the members then follow through with, when we go back to them, they say we are not happy with that, then the next question has to be, well, what do you want to do about it? Not what does the RCN have to do about it, what does the members want to do about it? Because that's at the time where we would be needing to look at working on mandates for industrial action. And I just want to draw attention to people listen to this. There is significantly high hurdles in order for any trade union in the UK, and specifically in the area of health, to take industrial action. The trade union legislation has made that exceptionally difficult. So we would have to have a high amount of members being balloted and a high amount of members responding positively to a ballot before we could get into industrial action, Helen. But if the members give us that mandate and we are in that position, the RCN is committed to fully supporting the members in any action that they want to take.
Thank you both for your answers on that question, because I think it's often a very difficult one for people to answer, because as you both quite rightly said, it's not a place that we want to be, and for our members, they want to be valued for doing what they do well, and that's caring and looking out for patients. So I think it was really helpful to get both sides, both the trade union perspective from you, Graham, and also the professional nursing perspective from Rachel. So I'm going to move on to another question. We are just about to hit the halfway mark, so we'll keep moving through questions, and again try and get as many as we can. The recording will also go up onto YouTube after this evening's session, so you'll be able to either watch it back or encourage your colleagues who weren't able to join us tonight to do that. So the next question, and I think I'll go to you first, Rachel. How does the RCN campaign include nurses who are not currently on Agenda for Change pay scales? So, for example, nurses working in general practice, nurses working in agencies, nurses working in care homes, and obviously nursing support workers in those areas as well.
Thank you, Helen, and again, a really important question, one that I'll probably ask Graham to come in fairly quickly on, but I think you know, this campaign is initially focused on Agenda for Change and the NHS, but I think we absolutely recognise across the college that we represent members who are working in many different sectors, and we had our meeting of the Professional Nursing Committee today. It was one of the things that we were talking about was the complexity of the independent sector, social care sector, nurses working in GP practices, all of whom have very different ways of negotiating pay. And I think what I'd say is that, you know, if we can get the Agenda for Change right, if we can get NHS pay right, that gives a benchmark. And if you look at a lot of the salaries, then they do follow the what happens with the NHS in terms of, you know, a market for nursing, then actually that helps if we can lift up pay for those nurses working in NHS and others on the Agenda for Change pay scales, then that will have a knock-on effect to others. But I think we are also looking, and it's something that I'm sure Graham will talk more about, at how we can more effectively represent members in terms of supporting members who might be entering into pay negotiations in a different context, but it's perhaps one that I'll pass on to Graham.
Thank you, Rachel. Graham, do you need me to just remind you of the question? It was about if this campaign, does it apply to those currently not on Agenda for Change, for example, nurses working in general practice, nursing support workers working in care homes, etc.
Yeah, I think the first thing that I want to draw everyone's attention to that's online, it says hashtag fair pay for nursing. It doesn't say hashtag fair pay for NHS nursing. So this campaign, although we've kicked up and we've concentrated our efforts on the Agenda for Change pay deal, the hashtag is around NHS. It's not around NHS in its entirety. It's actually about fair pay for nursing. And I'd just like to draw members' attention to the fact that we've got, and we approved a member pay policy in June of this year that was approved at council, and that is to basically say that we are saying that all nurses deserve a substantive pay rise. All nurses deserve a substantive pay rise all the way through that. So there are various negotiating mechanisms in place within the independent sector and GP colleagues, etc., GP nursing colleagues, etc. But what we have got is we've got a piece of work. It's a task and finish group that's been set up by council, which is looking at independent sector and looking at all the mechanisms across the independent sector. And one of those strands is pay. And we are looking very, very closely at how we can link in, as the pay working group can link in with that piece of work. And there'll be some work getting done on that quite quickly to come back to the committee. So you are not the forgotten people at all. You are 40% of the membership, and we recognise that. And what we do recognise is that the mechanisms that you use are variant and quite wide. So we're looking at different ways of how that is going to be supported, and that's been the work that Theresa Fife has been carrying out with the independent sector task force. So there's a lot of work going on. It's not quite ready to be surfaced as yet, but you're not forgotten, and the pay campaign is your campaign as well. What Rachel said is quite correct. There is a lot of benchmarking goes on against the NHS and against Agenda for Change. The last things that people need is workforce migration to do with salary. So therefore there is a tension that happens. If one goes up and the other one stays low, the workforce will move to the one that's at the highest. That's recognised in a recognised statistic. So therefore that benchmarking is quite solidly proven. I think that probably is all I would like to say on that at the moment, Helen.
Thank you both. That was I think a useful discussion to have, and a theme that's come up in some other pay Q&As that we've done. So really important that we talk about the membership outside of the NHS and the work that we're doing in that space. Rachel, I'm going to come to you for this one first, but Graham, you may want to have a say as well. The questioner is asking, can you say a bit more about how we can articulate the social value of nursing in a way that the public and politicians feel able to support us more with our pay requests? I'm going to come to you first on that one, Rachel. I wonder if your committee have been deliberating this issue.
It is something that we have been deliberating. Yes, Helen, and I think it's a really critical and a really difficult issue, because absolutely nursing has a value to society that is way beyond you know, the sort of the traditional tasks that people think about in terms of nurses. And I think that we've seen some of that through the time of the pandemic, is actually seeing nurses, the role that nurses play in society more widely, away from some of the clinical roles, the way that the values of nursing in terms of, you know, the professionalism of nursing, the values of kindness, compassion, but also being able to advocate for patients, advocate for those who are less able to advocate for themselves. And I think that we see nursing working in a whole variety of different contexts. And I think one of the things that we have talked about as a committee is one of the bits of work that we're looking to take forward is really how we get that, change the perception of nursing, so that people understand the depth of the profession. I think one of the things that came out quite strongly to me from the, you know, again, going back to the member survey and some of that rich data, is people talking about, you know, nursing is not just what we do, it's who we are, and it's what role we take in society, and that nurses can be real agents of change. And we see that nationally. And I think it's something that we need to make more, to take more clearly forwards. I think we've seen it internationally. I think one of the things that we can very easily forget this year is that this is the International Year of the Nurse and the Midwife, and the State of the World's Nursing Report, which was published back in April, really was published and almost disappeared without trace under the deluge of COVID, really. But what that talked about again was how nurses can be agents for social change, and I think it's a really important bit of work that we need to try and move forward nationally, but also working with colleagues internationally.
Thank you, Rachel.
Yeah,
that's for me, that was a bit of a light bulb moment, you making reference to the International Year of the Nurse and Midwife. And, you know, we all know the wonderful things we have planned to do the celebrating. So it's great that you've reminded us of that in terms of that real social value of nursing. I guess for me, that's part of the holistic nature of nursing that you can't always articulate, but we know that patients value it so very, very highly.
And I think we're not always good at articulating it. And I think which is why I'm going, whoa. But it's, you know, we need to get better at articulating that.
And partly that brings me over to my next question, which I'm going to go to Graham on, because it sort of links to that. How do we articulate what we do in terms of where we go next? So, Graham, I'm going to come to you to this one first. But again, Rachel, if you want to have a say afterwards, then I can bring you in. What are we doing, Graham, to prepare people for potential industrial action? How will we train members to campaign beyond giving them a digital campaign to undertake? Who will be our ears and eyes in the workplaces, and what can members do to get involved? And I guess I'm asking you as well to think about your answer to this in terms of what Rachel was saying about how we articulate what nursing does, not just within ourselves, but on that kind of wider audience. So no pressure for that very wide-ranging question that I just asked you.
Yeah, and I'm going to immediately try and close the scope, as you knew I would. First and foremost, the industrial action, what I've said is that we are looking to do a pay campaign that will avoid industrial action. That's the intention here. It's not an intention that we're doing a pay. Otherwise we would have asked for a pay claim of 50%. If the RCN was wanting to go into a period of industrial action, we would ask for something that's unrealistic and unachievable. What we are saying here is we believe that this pay claim that we have got is something that is achievable, and if the government makes the correct choices and the correct decisions when it comes to comprehensive spending review and when it comes to assigning a pay award, they can make the right choices, and that will avoid any thought of industrial action going forward. However, when that does come into play, or should I say if it does come into play and we are going down that route of a government who are not going to actually negotiate with us in a proper way or give us what is a reasonable offer, then we would need to look at how we would organise for industrial action. We would take a lot of the modelling that has been done within Northern Ireland. Number one, the first thing that we need to actually understand is the RCN now has in preparation for the industrial action in Northern Ireland and in Guernsey, we have an industrial action handbook, which actually allows us to set up all the mechanisms with the health authorities and the trusts, etc., across the whole country, and allows us to actually implement industrial action in a safe way that actually does not impact adversely on the critical safe roles that patients are, within ICUs, etc. So we would, all of that is taken into account and built up. So in terms of that's industrial action and how do we prepare that? Most of the time we would be activating our stewards network, because the stewards network is the areas where with the professional officers of the RCN that would look at how do we set up industrial action groups within healthcares and trusts, etc. So we are prepared for that should we have to go down that route. Let's hope we don't. Let's hope the government give a significant pay rise and we can get this dealt with once and for all, but we never know. So how do members get involved around that? Well, members need to get involved. We know that the light has been shone on nursing. People all of a sudden have realised what these professional people actually do day in, day out, but not just during COVID. It's been happening for years. COVID has shone the light on it, but now what we need to do is make sure that the public completely engage and understand that, and at the moment they do. I've never known it in my lifetime where people stand on their doorsteps to actually thank nurses, as well as all the other care workers that have dedicated their life to actually looking after people through COVID. It's never been known, so that public support is valuable, and it really needs us to actually make sure that we nurture that support and we don't lose it. So in that respect, there is that, and we need to work our way through that. And the International Year of the Nurse allows us to do that because it can highlight and spotlight areas of practice that have been completely unheard of. There's some really good community engagement opportunities, and not opportunities, what's the word I'm looking for? Community engagement strategies that are actually looking after people in the community, vulnerable people, looking after asylum seekers. So the community is actually embracing the whole subject of nursing at the moment and seeing all of the activities that are going on around that. And we need to highlight that, and we need to bring that to the fore. Safe staffing. Nobody wants to put their mum, dad, sister, brother into a hospital where they feel that they're not safe. So we've got a real challenge to actually make sure that we work towards that safe staffing and demonstrate those links, those economic links around people leaving the profession and actually wanting to stay in the profession. But actually, see, when you feel valued, your patient outcomes start to improve. See, when you feel valued, people, it's actually recorded. When a staff and when a team of nurses feel valued, patients' stays in hospital are actually decreased. It becomes much more of an economic lever for the health service to actually improve their economic turnaround, if you like, their effectiveness. So all of these things we can roll into a model to actually just support that. The last bit was around, Helen, just remind me, was it about how do we activate our reps?
Yeah, how members can get involved in the campaign.
Well, the first thing is your nurses, you talk, you communicate very, very effectively for a living. Can you please communicate how important this is for you, to your friends, to your families? I would say go to the pubs, but actually they're out of bounds at the moment. Certainly they are, and becoming more hard to get to in Scotland. We can't even visit each other anymore in Scotland, which brings me on to the last bit, which was around this whole idea of campaigning on the ground. We no longer can walk the floors of hospitals. It's discouraged. We shouldn't be. We'd be like butterflies spreading infection. We can't do that. We're no longer able to engage in the same way that we have done in the past. So we have to think of different ways of engaging. And those ways of engaging are, and that's why we've selected at the moment to launch on very much a social media type campaign. But that will be continually under review. Now, you can do a lot on social media. You can instigate written campaigns, video campaigns. It would be really good if members that are listening tonight could actually get on their phones and actually do a video and send it in to us to actually understand. And that's part of our campaign, to actually understand what is it nursing means to you and what it's been like during that, and what a 12.5% pay rise would mean for you. That's really important and starts to give us some good campaigning materials. We will support anything that we've got. This has to be a grassroots campaign, Helen. It's not a campaign that can be sitting corporately. It has to be up to the members, led by the members, for the members, and where the members are actually engaged and active throughout this. There will be a campaign, some messages to actually make sure that we're engaging with politicians next week. So we need to make sure that we're looking at our key stakeholders all the way through that, and where we need to press our influence to the greatest effect. So I think I'll probably pause there. That was a bit of a run through of some of the ideas that I have, more than actually. I don't think I answered all of the question, but you can come back to me.
Thank you, Graham. Thank you for answering that one. I'm really conscious that we're running out of time, and there's a lot of questions coming into the chat box. We've had well over 50 questions tonight, so I'm doing a little bit again of host license. I'm trying to pick out the ones that are getting the likes on that screen as well. So Graham, I'm afraid I'm going to keep you on the spot for this one, and this is coming from a questioner who's saying the GMB has listened to their members and is calling for a 15% pay rise. Are you saying we should leave the college and join them if we want what they are working so hard for? I think that's a tricky one for you, but I know as the chair of the Trade Union Committee, you're pretty good at taking on these really difficult questions head on. So I wonder if you could give us your thoughts on that one.
First and foremost, I would hope that you wouldn't leave. I would then ask what membership engagement, because basically I know what the membership engagement has been around the RCN, and that membership engagement was 42,000 members, but the engagement exercise was 450,000 members. I'll draw your attention to the fact that 13 trade unions were coalescing and one trade union was not coalescing, one trade union was standing out. I'll draw your attention to that fact because actually that trade union that was standing above all was the Royal College of Nursing. So what I also would wonder around the number of nurses that we've got within that trade union and the number of, I think that we claim, and I will make no apologies for this, we claim to be the voice of nursing. And what we are doing within this trade union that you belong to is we will stand ground, and we will stand ground for nursing and for nurses. So I haven't directly answered your question about the GMB. I am not in a position where I can comment on how another union reached its decisions, but I would ask questions around. All I can do is indicate to you where we got our decisions from. So a bit of a sidestep, but hopefully it gives some of the answer, Helen.
Thank you, Graham, and thank you for taking that one head on. I think it's really important that we try and answer as many of the questions coming in, the ones that are, the ones that we feel comfortable with, the ones that are a bit more difficult, because it just shows how complex the whole issue of safe staffing and pay can be, and the range of views that are there across our membership. So thank you for taking that one. Rachel, I'm going to come to you next. This is a question that a member has been asking, and they're saying that nurses are exhausted both physically and mentally after the past 5 months. With the forthcoming winter and the anticipated rises in COVID-19 cases, it'll be even harder to expect nurses to really have the energy for this long fight. Do you think they will have the energy to continue to want to fight for a decent, substantive pay rise for 2021?
Thank you, Helen, and absolutely recognise the truth in that nurses are, many of them both physically and mentally exhausted over these months, facing winter, which is always difficult and likely to be a very difficult winter this year. I think what I would say in terms of have people got the energy for this, so part of what I think our responsibility across members and staff active within the college is to support members. I think when again going back to the member survey, I think one of the things that came again through clearly to me was the passion that people have for nursing and for the profession, and also the strong feeling that they have that the commitment, the work, all that they've done that has made people emotionally tired, exhausted, is not recognised. It's not recognised particularly by government. In some cases, it's not recognised by by senior managers. I think there is recognition there from the public, but I think there's a concern that that as we hit hard times economically, some of that support may ebb away. But I think that what this campaign is about recognising the value of nursing, and that the fair pay is to recognise that actually that's what nurses deserve. It's what we deserve, but it's also about how we can try and address that staffing crisis. So going back to putting together both pay and staffing, that actually we want to encourage more people to come into our profession. We want to keep people who are here with us. We want to perhaps bring some people back who've left, and fair pay will help us with all of that. So I think that with support, then people will get behind this campaign, because it's about how we value them and their work.
Thank you, Rachel. Sorry, having trouble getting my mute button off there. Thank you very much for that answer. I'm still trying to squeeze in as many questions as I can. And so I'm going to go back to Graham, just give you a minute before I come back to you, Rachel. It's another tricky one for you, Graham, but I do like to keep you on that hot seat as the chair of the Trade Union Committee. I know you're quite used to it. And this one is asking, the member is asking, do you think that the disarray that the RCN finds itself with the presidential elections will have an effect on our negotiations for pay 2021? So again, a really poignant question from a member for you, Graham.
It's a really difficult one, because I recognise the traumatic and basically the difficult times that we've been going through as a college, and and I do recognise that. I have hope. We have now a chair and a vice chair of council, We have some clear direction from our incumbent president around that. There has been a letter from Donna around all of that. Do I think it's had an influence over over the pay launch? I think it most definitely has had an influence over the launch of the campaign. However, do I think whether it will have a negative effect on the negotiations? Well, the first thing is that time is a wonderful healer. I'm hoping that this will be resolved in good time and in appropriate time. But I just want to draw members' attention to the fact that the government has not given any clear indication of how it's going to deal with pay. It's likely that that will be the pay review body process. So before we get to the point of the pay review body process, we will be submitting evidence. Now that evidence will remain the same whether the presidential election's taking place or not. So the evidence to the pay review body will remain the same, and that will be a constant. By the time it comes back from the peer review body, we should be looking at the spring of 2021. I would hope that that has then been taken. So the pay campaign is a long campaign. This is a marathon and not a sprint. This is going to be a long and rocky road that we're travelling in. I consider the launch of the campaign and the issues around the presidential election. I consider them some of the rocky paths that we'll have to go through, and we may have more like that, and we may have more areas which will be rough, but there will be periods of time where things will be quiet in a campaign, and there'll be periods of time where there'll be a lot of activity, and there are key milestones that we need to address. So do I think it will have an impact on the negotiations? Essentially, no, because I'm hoping that it will all be resolved by that time, and we will be in those negotiations with a fully supportive trade union and professional side, with a president and a deputy president and a chair of council and a vice chair of council, and all of the governance structures in place that will help us to deliver that. But most important of those governance structures is an entirely engaged membership. That's the most important part. It's the entirely engaged membership. We will never do this without the members.
Thank you, Graham, for taking that question. We've got 3 minutes left, so I'm going to try and squeeze in a last question to you, Rachel, but I'm going to kind of limit you to 1 minute. And the reason I want to get this one in is because I think it is really, really important. We've talked a bit about members outside of AFC, but this questioner has made some comments about community. So I'm literally only going to have a minute or so. But the question is that there's been a lot of resolve around what appears to be hospital staffing, around particularly in the safe and effective care aspect, but safe staffing levels are at critical levels in the community. So how can we push the community role and the pay and safe staffing, I beg your pardon, in the community as well? Thank you, Rachel.
In 1 minute. So in terms of the pay, I think to reiterate what Graham said about that this campaign is about fair pay for nursing, and that's nursing wherever they work, people work. I think one of the things that we've been in our professional nursing committee meeting today, actually, we were looking at workforce principles to support the campaign for staffing for safe and effective care, or workforce standards for the Royal College of Nursing, and that's in all sectors. So that absolutely is not just in acute care. It's also how we address some of those core standards in community as well as in acute care. So I agree that it can often feel like the focus is on NHS, the focus is on hospitals, but that's something that we're really trying to shift. And I think that that's the case, across both the Professional Nursing Committee, the Trade Union Committee, and across the work of the college.
Thank you, and excellently done in the short time frame that I gave you. It really just leaves me now to thank the panel. There are a number of comments coming in about the value of nursing and speaking up for nursing that haven't really been questions that I will definitely share with our panelists after this session. But I'm sure you'd all want to join me in saying thank you to Rachel and Graham for taking your questions. They've answered a significant number this evening. We've talked about how we arrived at the RCN pay claim. We've talked about the campaign as it continues, as well as the effect of it both in the community on safe staffing and members outside of the NHS, as well as trying to pull in some of the aspects to do with how we work with other unions. So you've done a super job of answering questions. Very grateful to you both for doing that. So just to remind the audience that there will be a further Q&A session. So if you haven't managed to get your question answered this time, please do come and join us again, and that will be on Monday the 14th of September at 8 o'clock, and you'll find more details of that obviously on our website. This evening's session has been recorded and it will be going up onto YouTube, so please do encourage your colleagues who weren't able to join us tonight to come along and have a look at the YouTube film so that they can see the answers that have been given this evening. So once again, thank you very much. Please stay safe and we look forward to seeing you on the 14th of September. Good night.